Hi, my name is Emily Benford, and this is my occupational therapy portfolio. So, a little bit about myself. I am currently a junior occupational therapy major at St. Francis University. So, I wanted to become an OT because of what they did for me when I was younger. At 2 years old, I was diagnosed with Guillain-Barré syndrome. It's a disease where your immune system is taxed by your nervous system, and there can be a lot of complications, and a lot of times it will result in death. Um, I'm thankful for the OTs that I worked with because they helped me overcome this obstacle and live a normal life. So, domain one is planning and preparation, and I'm going to talk about demonstrating knowledge of resources. So, as an occupational therapy, there are so many resources that can be used for different activities. So, when I shadowed different OTs, they were able to use the same equipment, but a lot of them were able to twist it and use it in their own way. Something as simple as shaving cream can be used to get a child moving their hands and fingers. It doesn't really matter what you use as long as you know what resources you have and how they can be used. Being an OT is exciting because you get to be very creative with what you do. And as long as your client is enjoying the activity and also getting um, the exercises that they need out of it, it's going to be beneficial for both of you. The second subdomain for this is designing student assessment goal achievement. So it is important to do different things that are able to show you how much the child is improving. One of the OTs I shadowed would challenge their child to do better each time by throwing a ball and recording it with a stopwatch. The child would get motivated to beat their time that they had last time, and it was fun for them, and it was also very rewarding to see how much better they would get with each time that they did. In domain two is the environment and managing student behavior. So student behavior is very important, especially when a healthcare providers. Children can be very active and hard to handle, especially when they're around people that they don't know. So when I shouted at Kids First, there was a girl that was very disrespectful to OT. Um, she didn't listen to the OT. She didn't listen to her mom. Her mom had to threaten her that she wouldn't go to her own birthday party if she didn't listen. When the OT and her mom would try to get her to do activities, she would growl and hiss at her mom. So the whole session was pretty much trying to get the little girl to calm down and do her activities. The OT was very patient with her, and that was something that like really impressed me because it takes a lot to handle kids, and the way that she did it was very eye-opening and it was very impressive to me. If the OT would have gotten really mad or angry with the little girl, it probably would have made situations a lot harder. So managing student behavior is very important, especially if you're trying to get the child to complete an activity. So organizing physical space, this is a really important one to me. So having a space to work in is really great, but you need to make sure that it's organized and that you know where everything is. If you are unorganized, you will not be able to know where things are or use your time effectively. The client will perform better, focus more if they're in an environment that is clean, put together, not crowded. Um, they should know that when they come to this area, they're supposed to focus and get ready to work. Having an organized space will help things flow smoothly, get the maximum results, and it won't take time out of your session or your client's session trying to find things that you don't know where they are. Domain three is service delivery and using questions and discussion techniques, gathering information. So one of the easiest ways that you're able to find out what is going on with a patient is to just ask them questions, start conversation with them, and get them to give a little bit of background of what's going on with them. Um, when I've shadowed the OT, she made small conversation with the children, and she was able to gain a lot of information without them really knowing. It was something that was like really easy to do, but it was also very informative. So asking questions and making a connection with the client is very helpful when you are trying to get information about them. Demonstrating flexibility and responsiveness. So flexibility and responsiveness are two very important aspects that OTs need to be able to understand. So OTs usually plan out their day and they know what they want to happen, but sometimes it's going to change. Patients might not be having a good day, they might not want to do something, and the OTs are going to have to switch up their plans in order for them to complete an activity and get the exercises that they need to get done. So sometimes an activity is too hard, and the OT just needs to be able to notice this and like scale it back to a level that is easier for them. So when I shadowed Kids First, there was a girl that was really hard to deal with, and she really needed to be flexible with OT. So she was very hyper and couldn't calm down. So instead of the OT forcing her to do things that she didn't want to do, the OT encouraged her to do things that she wanted to do and was able to do like incorporate exercises into it that the little girl could do even though she was so hyper. And domain 4 is professional development, professional learning, maintaining accurate records. So in order to give the best care to your clients, you have to make sure that you are keeping accurate records of the progress that they are making. Keeping a record of every time that you see the patient helps you evaluate their progress, helps you plan out the next step that they want to take, and helps them reach their goals. So making sure that the exercises aren't too hard, aren't too easy, and are very achievable is very important. You don't want the client to give up or fly through it with ease. So you want to challenge your client in order to make sure that they're getting things done and also improving along the way. So by keeping a progress report is easier to see how much they are improving and how you can start challenging them more throughout their therapy. And showing professionalism. So this is one that I feel like applies to me. Um, so it is very important that you show up on time to your job. Like you only have a certain amount of time to work with a patient, and you need to make sure that they are getting the time that they need. If you show up late, you're going to take away from their experience and from their improving. And also, it depends where you're working, but you should dress professionally. Professionally. Sometimes hospitals will let you wear scrubs, or sometimes they require you to wear khakis and a polo. Whatever it is, they're doing it to make sure that you look professional and that you can provide the best care to your clients. So those are all minds and mains. And I added just a few fun facts about OTs. So some of the ones that I found really interesting was 85% of all certified hand therapists are licensed occupational therapy therapists and have obtained specialized training to treat upper extremities. They're also trained to design, select, fabricate, and train on splints for patients with hand and upper extremity injuries. And occupational therapist goals are always functional and enable you to live your life to the fullest. And that's the end of my portfolio.